Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us for the program today. Our guests are Dr. Johanna Contreras, cardiologist and volunteer with the American Heart Association, and she's joined by Akil Patterson, Deputy Director, Sugar-Free Kids of Maryland. And we're here to talk about the 10th U.S. city, the verge of passing a law intended to curb how many sugary drinks kids are consuming. Welcome to Health Professional Radio, both Dr. Contreras and Mr. Patterson. How are you both?
Doing well, thank you.
Good, thank you.
Akil, what is this latest city to consider these sugary drink legislation, and what types of drinks are we talking about? All sugary drinks or just some?
Well, it was in Baltimore City. Baltimore City then has actually passed the legislation, and the legislation is a kids' meal bill. It is a kids' meal bill that would focus on removing the fruit drinks, the lemonades, the sweet teas, the sports drinks, and the sodas from the kids' meal menu. And because we all know that the fruit drinks and the lemonades got everything but fruit or lemons in them. Mm-hmm. So we know that there is a disparity there. So we're changing that narrative and creating a culture of health in Baltimore City and in 10 other municipalities. That would have the default option be the healthier beverage, you know, the waters, the milk, the unsweetened teas, the other beverages like sparkling water. So we're really excited about this legislation passing. We know the mayor has been supportive of it in the past, and we are confident that she'll sign this bill into law in the next couple of days.
You know, with everything that we've been hearing about childhood obesity, Dr. Contreras, there's a new study that we're going to discuss briefly. What about this study about sugary drinks and heart health? Where was it conducted and how many were participating? So what are some of the revelations?
So this study has a questionnaire of more than 17,000 people. And basically what they found is that the people that consume about 24 ounces of sugary drinks, that is about the same thing as 2 cans of soda, or maybe a little bit more than 10 ounces of the sport drinks, have double the risk of coronary or heart disease. So the study found that was seen with sugar drinks. That was not the same thing seen with sugary meals. That doesn't mean you have to go and eat cupcakes and cookies, but it means that probably sugary foods have other nutrients. Instead of sugary drinks, they have water and sugar. So they found increased incidence of coronary artery disease. So
are these drinks being considered just from fast food restaurants or all restaurants and the school systems as well there in the Baltimore area?
We've got to recognize that on the federal level, they have much more stricter regulations than what we could produce in the school systems as of right now. So we're happy with the school systems. We are doing this for restaurants and food service industries in Baltimore City. So if you have a menu board or you have a restaurant menu, you've got to make sure that the healthier option is going to be posted and listed above. And it's been a long process to get this, to get this going. You know, we've tried to introduce legislation in the past. We've worked one-on-one with the legislators. We've made sure that they were informed and engaged. And we've talked about this issue enough that they've trusted us at Sugar-Free Kids Maryland to make sure that we're doing what's best for our communities.
Dr. Contreras, is too much sugar too much across the board, or is too much different for one child as opposed to another?
Obviously, like the American Heart Association have regulations and guidelines to see how much sugar children can consume. But basically, a child less than 2 years of age should not have any need to consume any sugary drink. And in children between 2 years and 18 years, the recommendation is 1 sugary drink a week. And in an adult, the recommendation would be no more than 3 sugary drinks a week. So you can imagine the study found that children are consuming 10 times the amount of sugar that is recommended by the American Heart Association.
Where does the responsibility lie, Akil? I mean, we've passed this legislation there in the Baltimore area, but what about the community and parents? Because sugar is, well, the most addictive thing on the planet. How do we curb that in addition to this new legislation?
Well, I think that there is the both and piece. There is the education and there is the legislation. So you have to have the both and. You have to have people that are willing to, put up the resources and the finances to educate the community on top of guys like me and people at Sugar-Free Kids who can go change the legislation. So there's got to be a both and. If I had a magic wand and I could just wave it and fix problems, I would. And I think all of us would, like, oh, we can fix that tomorrow. But we know it's a step process, so we're going to start with these beverages. Tomorrow we're going to start educating more communities. The next day we're going to look at kind of changing formulas. And I think, let's give our industry their respect. There are restaurants that are already doing this, so it's been a great move for them. But I think ultimately it's a community-wide effort from the person who sells soda to the gas station to the person who is instructing our MPH directors. We got to make sure that we're helping all those folks.
Have you been getting support for this legislation and this initiative across the board, or maybe a little bit of resistance from those who stand to benefit greatly from increased sales, or at least stable sales of sugary drinks to kids, if not to adults as well?
Well, obviously, you got a proponent and an opponent in everything that you do. So, it doesn't bother me that I get, harassed or teased by some of these big corporate guys. But we're out here doing what we think is best for our communities. I think I'm doing what's best for my community. And if they have other ideas or other ways that they would like to see things get done, we're more than happy to sit down with them and talk about it and really, come to a decision, what's best. We do know that we've asked things before, like stop selling your sugary sweetened beverage products altogether. They said no. So, hey, you got to keep working.
Dr. Contreras, what is the best way to get the conversation started with one of your patients, about their kids and the sugary drink consumption? It's kind of a touchy subject. It can be when you're talking about people's children.
So it's important, as I say to my patients, as parents, I know people are busy. I know parents have very short time. So I tell them, have water available. Take bottles of water, put some fruit in the water, put it in the refrigerator, freeze it up. When the kids come home from school or come home from playing outside in the ground, they know they can go into the freezer and find a bottle of water with frozen strawberries. They love that. And they can do these things very slowly and integrate that as part of the family. Have milk. Teach them how to make juice, how to take an orange and have a fresh squeezed orange juice in the morning instead of having to buy a juice. So I think we have to show our kids what we are like, and we have to change ourselves. That way our kids see what we are doing, and they're going to repeat to do what we are doing.
Now, in wrapping up, Akil, obviously you can't go all across the nation with your initiative. You mentioned communities becoming involved. Where can our listeners go and get some information about how they can get this initiative and possibly legislation passed in their communities, if that should be what they desire?
Well, you can reach out to your local American Heart Association and get part of the Voices for Healthy Kids Action Center, or go to voicesactioncenter.org and get your resources. And then you can always link up with us over at sugarfreekidsnd.org to have a conversation. And again, we're readily accessible. I'm on Twitter, Facebook, Snapchat, Instagram. I'm definitely out there in the community. So if you want to get a hold of us, we're all there. So check out voicesactioncenter.org.
Dr. Contreras, Akil, thank you both for coming in today. It's been a pleasure. You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at healthprofessionalradio.com.au and hpr.fm. Thank both of you for joining us today.
Thank you, Neal. Cheers.